This mitochondrial reboot therapy that we're doing is probably one of the most substantial things that we've ever done, and one of the most substantial things that people in medicine have ever done. It's called the mitochondrial reboot or recharge. So you'll hear those names interchangeably, but just for the speed, MDI is what we will call it for tonight.
Going to be just a lot of information. You don't need to know all the nitty gritty. We're going to give you the overview tonight. We're going to give you the possibilities tonight. We're going to give you some of the data that we have researched and been lucky enough to be a part of. Don't let yourself get overwhelmed. I am sure that some of this makes sense. Some of this doesn't make sense. We are happy to talk to you anytime in the clinic about this as we move forward, bringing this into the clinic.
Yeah, exactly. And our patients are across the board. Some people are like, just hook into my arm what I need and don't even tell me what it is. And some people are like, show me all the 85 studies for the last 50 years. So wherever you fall on that spectrum, we will meet you with that. We just don't want to overwhelm everybody. So with that being said, I'm going to go ahead and share my screen. When I'm on this, when I have my screen shared, I can't see the questions. So Sarah interrupts me if those come in and we need to answer as we go versus we can answer them
Sure.
at the end. Okay. So let me share this and then we will do, and we are recording, so we're good there. The slideshow. Can you see the right screen, everybody? Okay,
Yeah.
perfect. All right, so tonight's discussion, we're going to take you through the basics. What are mitochondria? If you've never heard of those before, it is the powerhouses of your cell. It is life itself. We're going to talk about why they slow down or quit working over time, and they never totally quit. How does that translate to illness? How many of you are tired or fatigued ever? Get worn out easy? You're tired because your cells are tired. That is a mitochondrial problem. So keep that in mind as we talk about this. What the heck is this mitochondrial reboot? What is it? Do I swallow it? Do I get it in my veins? Do I sit in a machine? What is it? We're going to get into that. And then we're going to close out with who can benefit. Some of our patients, we've already talked to you directly if we've seen you since we've brought it in. We're going to go over some data. Now, I want to be very clear. I'm going to present you some very clear data that was introduced to us during our training, both by the doctor who developed the technology and the doctor we trained with. Very few clinics in the world actually have this technology. I think we're talking like 7 or 8 total clinics in the world I'm aware of. Could be more, but that's what I'm aware of. They've treated over 600,000 patients over the last 30 years. So the technology is not new. This is FDA approved at the highest levels for all the things we're treating. And of course, we're going to leave time for open discussion at the end. So what are mitochondria? If you think of our cells, mitochondria are the powerhouses in our cells that take food that we eat and turn it into energy. So if you didn't know this, at any point in time, we have about 250 grams of ATP, but we recycle our body weight in ATP every day. So you can live about 60 seconds if your body stopped making ATP. ATP is life. So your mitochondria is life itself. So what happens? So we're going to talk a lot tonight about diabetes, but all of this is rooted in mitochondrial dysfunction. And some of these slides were borrowed from the developer who came up with this. Inside a cell, if you can picture a cell, inside of that are these little lima bean looking things. And all of this surface area, all it's doing is creating ATP. It's cycling ATP for energy. They have your own DNA and it's from your mother. So we call it the mother DNA. So the maternal side is life itself. This is where some of the mitochondrial problems are maternally inherited. So you'll see this down the mother's genetic sideline. So when you have diabetes, what happens is these cells that normally, I'm going to go back, take food, take glucose and activate it to ATP, they stop being able to use glucose. So your body sits in a pool of sugar and your mitochondria are sitting there unable to use it, starving to death. It's basically what happens in diabetes. So if you know anyone with type 2 diabetes who might be overweight, if they're hungry all the time, that is because their cells are literally starving for the right fuel. So what happens, imagine if you have a truck or tractor and you put the wrong fuel in it, it doesn't run as well and it puts off a dirty exhaust. The same thing happens in your body. If you're using the wrong fuel in your body, it's not going to run as effectively, and you're going to put off this dirty exhaust called oxidative stress. This is what causes downstream complications from diabetes. As we age, our mitochondria become less efficient. So when we talk about diabetes, or this is early aging. So you look at anybody who's been a type 1 or type 2 diabetic, they age a lot faster than the rest of us because they're creating that oxidative stress, that downstream exhaust that's not clean. So when I say things like this is the holy grail of medicine, the single source of cellular health is in the mitochondria. So every cell, to be a cell the way it's meant to be, has to have energy production. So the cells that make testosterone have to have enough energy to put that together. The cells that are muscles have to have mitochondria that perform, or you'll have weakness. The inflammation cells that control your immune system, all of this, they have to have enough energy production to do this. So you have the metabolic stress response. Guess what happens? You increase your stress hormones. You increase all of the things we don't want in our body. And when we have that, we have increased reactive oxygen species, or ROS. We have increased transcription factors, which triggers a sequence of downstream inflammatory effects. And what does that do? That causes cellular injury, cell death, inflammation, tissue damage. So think autoimmune conditions. Altered tissue or wound repair. We're going to look at a wound that's I used to run a wound clinic. It's one of the worst wounds I've ever seen. And this helped grow it back. Infarction and ischemia. So when we think of all of these things, we're thinking it affects the individual cells, but cells make organs. So when we think of organ dysfunction, you think of hypothyroidism. Your thyroid doesn't have enough energy. It needs the ingredients to make the recipe, but it needs the fuel to put it together. Same thing with your heart. Think about your heart's pumping all the time. That takes a lot of energy to pump constantly. It never takes a break. So imagine if you were using your muscles and never took a break. Your brain uses 70% of your energy production. So when we think about things like dementia, neurologic issues, stroke, our brain is super susceptible to low mitochondrial function because it needs that high energy output to work correctly. So again, when we get down the wrong pattern and we snowball in the wrong direction, guess what? That's all the things we don't want. So when we have mitochondrial dysfunction, that oxidative stress that modern medicine doesn't acknowledge, if you ask a regular doctor about it, not an integrative doctor, that reactive oxygen species, look what happens in mitochondria, that start to break apart. They don't function. And then we lose our calcium homeostasis. We lose our ATP synthesis. This is cancer. Think of cancer. We lose our ability to modulate heat and cold. Hypothyroidism. If you know anybody who's cold all the time, right here. This is how our body makes energy. Imagine this is like a water wheel where every single piece of this has to travel. And methylene blue hijacks the last one. That's why people who take methylene blue have more energy, and like it clears their thinking because they're hijacking the energy production process, and it's clearest because the brain is most dependent. That's where they see it first. High blood pressure, mitochondrial problem. The mitochondria can't deal with all these reactive oxygen species. And so over time, what happens is the cells in the lining of our arteries can't recover. They can't continue to repair themselves because they're not working efficiently. And we get atherosclerosis, we get high blood pressure, thickening of the artery walls. That is a mitochondrial process. So how does that translate to illness? Again, if you have a person who is diabetic, they live in a sea of blood sugar, but they can't use it for fuel. So on one hand, their cells are not firing properly. They're making all this dirty exhaust. But on the other hand, we're leaving all this sugar in the blood space, in the blood vessels, in the serum. That's super inflammatory to the rest of the body. So you had the 2 to 3 pronged mechanism of what causes downstream problems. Dementia, type 3 diabetes, because the brain is swimming in sugar, can't use it for fuel. Neuropathy. Neuropathy responds really well to this because those nerves depend on that energy supply. So when you have somebody who's got neuropathy, that numbness and tingling in their hands and feet, that is because they have reactive oxygen species. They're starting to damage those distal nerves, causing a problem. Vascular disease. An interesting thing, and we're going to get into this very soon, a new toy that we're bringing in, is most of our vasculature. We think about the aorta, the coronary arteries, the arteries to the kidneys and to the legs. That's 1% of our arteries. 99% of our arteries live in the capillaries, the little tiny blood vessels that deliver all of these things, nutrients and oxygen to the individual cells. They break. They don't get the energy that they need. So this is lower, like leg ischemia. This is strokes. This is heart attacks. Whatever the ischemic thing is, just a downstream from where the blood flow goes. You guys know that. Again, fatigue. If you're tired, it's because your mitochondria are not firing very well. Hormone issues. Men with low testosterone. Why do we have that? Several things: endocrine disruptors, poor nutrition, but low mitochondrial output is another one. So when these start to pile up, the body loses the ability to repair itself. So if you have mitochondria that are firing on all cylinders, you can't have cancer. You can't have cancer because your body finds it, attacks it, takes it out, you're done. So this is an imbalance in mitochondria. We all know that there's a metabolic root to cancer. This is it, or part of it. So what the heck are we talking about, and what code got uncracked? And I just can't overemphasize the genius of the people who figured this out. So dating back to 1977, what they figured out is there's a secret chemical communication between the pancreas and the liver. So they put catheters in the arteries and veins to measure the actual insulin levels between the pancreas and the liver. And what they found out is that happens in a pulsatile fashion on a microscopic level. So if you can think of a microscopic oscillation, it happens every 6 minutes. And that is the signal from the pancreas to the liver to release enzymes that the mitochondria depend on for life. That's it. That's the code that they cracked. And it goes back to 1977. So if you research this, and I have all of these studies somewhere on a slide, it's been a very busy month. So I have it all. I just don't have it all in the talk tonight. Never has that been refuted. The pulsatile flow of insulin from the pancreas to the liver has been repeatedly documented in animals and humans over the last 50 years. Everyone agrees on that. It's just the people we trained with that developed this were brilliant enough to do something about it. And why did they do that? The inventor of this device had a daughter that was diagnosed with type 1 diabetes at age 2. So you want to talk about motivation? That's the motivation. So again, the pancreas, every 3 to 6 minutes, is going to burst insulin to the liver in a pattern like this. And over a period of probably a decade, this brilliant engineer came up with a way to replicate this in a pump. And so we can replicate the healthy signal from the pancreas to the liver using an IV pump and do it externally. So this is what we're recreating. This signal every 6 minutes tells the liver, turn on the mitochondria, release the enzymes that wake up all the mitochondria. We have billions and trillions and gazillions of mitochondria in our body, billions in our eyes. So it sends that enzymatic signal to wake those up. So here's just another example. They looked at the portal vein insulin and see how it pulsates over time. That goes to the liver. The liver creates the signal. And what happens is it also dampens the signal so that if we test your insulin levels in your body, it doesn't fluctuate because it's this microscopic oscillation between the pancreas and the liver. The liver then dampens the signal. We test a fasting insulin level. It doesn't translate the same. So some of the slides that we're going to look at were taken from the presentations that were given to us. So 50 studies have, over time, have shown that these bursts every 4 to 6 minutes with an amplitude of 600% variation. So this pulsation is a huge variation in the study. And here's what the pump looks like. So to answer your question, the treatment is actually a 3-hour infusion in our office. You're going to get a tiny volume of fluid, like 3 to 4 cc's of fluid. We push more than that to push the meds in. And this pump is specifically designed to replicate this oscillation signal to your liver to release the enzymes to wake up the mitochondria. And on the downstream, it has been studied in great detail that this one treatment increases your ATP production by 29%. It's been studied with max VO2 testing. It's been studied with all kinds of energy output devices. So it's a 3-hour infusion. So you sit in the office, you're going to be chugging sugar. This is the part I have problems with because all of us know we shouldn't be eating sugar. However, when we wake up these mitochondria, they're looking for sugar to feed on. And so we've got to have enough sugar in the bloodstream to feed the mitochondria. So the pump is going to send the signal. So every 6 minutes, you're going to hear it do a little whirly woo, and that's going into your vein. And it's really fascinating when you listen to the developer because he says, I have to overcome things like high blood pressure, inflammatory cytokines circulating, like that changes the viscosity of the blood. So if you start to look at all the things they've accounted for over the years, it's just so brilliant. So then the liver,
Couple questions
yeah,
coming in. Sorry. You don't wear the pump 24/7, like Molly said here. It's a 3-hour infusion that you'll do in the office, and it's pretty supervised. We're checking your blood sugar every 10 to 15 minutes manually just to verify that we're dialed into you specifically. Again, we're trying to recreate a normal, healthy pattern, which we at times lack. So we're trying to recreate that 660% oscillation kind of trough and valley over a 6-minute cycle repeatedly to force the mitochondria to either A, repair or die off and restart this kind of metabolic process on a cellular level. In the vial, all that there is a couple units of insulin, very low dose, probably 3 units of insulin and 3 units of sterile saline.
it's 30 units of insulin, but diluted in 10 cc's of volume. So you're going to get 3 to 5 units total in your infusion. Yes. Yeah.
Very
Total.
tiny dose.
Right. So the reason that your blood sugar drops is not that we're giving you a bunch of insulin. It's because your mitochondria are waking up and they're like starving. So they're like at a buffet, eating it all up and energizing. So this is why we have to keep our sugars up. And there was a question, and specifically all the questions I've had, you probably have too, which is if I'm cancer and I'm not eating sugar, how am I going to eat sugar for this? And the answer is because you want to feed the healthy cells all around it so they can crowd it out. Because those healthy
And we're
cells
also using yeah, we're using that insulin to put it where it needs to go. It's not sitting in the bloodstream unutilized like it would if you took this in through your diet.
yeah. So again, 29% in ATP production is repeated in study after study. Virtually every condition has been studied. And this is where the MD or MDI induces the needed metabolic response. It works, and I hate to say this, but it works for everything because it is the absolute root cause of the root cause. So by feeding the mitochondria and getting the mitochondria to work on the fuel that it's supposed to work on. So now take that car that was running on the wrong fuel, put the right fuel in it and clear out the old stuff. It reduces the downstream inflammatory cytokines that are driving organ injury. Again, increases the missing energy that our body needs to function optimally and balances the pathways that are needed for metabolism. So again, it's going to correct all of the things that are starting to go wonky because your mitochondria are not working well. So it's that downstream snowball in the right direction that we need to see to reduce the complications of diabetes. So again, the pump recreates the signal. This is the magic of the treatment right here. It is not the insulin in the tubing. It is not the IV. It's not the 3 hours. It is the pump, the microdose infusion pump. Okay. So this is where it gets powerful. And I tried to use exact clips from their exact presentations for a reason, not to plagiarize, but because I want you to understand the things that they've seen in their huge patient experience. So the MDI restores the basic metabolism, and all measured patients to date have shown highly significant improvement. And look at these conditions. Alzheimer's. Do you know anything that can reverse Alzheimer's right now? The Bredesen protocol is the closest, and all of the meds on the market reduce the rate of decline. You're still going to get worse, but you're going to get worse slower if you're on Alzheimer's meds. Fatty liver. How many of you have fatty liver and your doctor just said, oh, you have fatty liver and moved on because they have no treatment options for you? They have no idea where to start on this. Stroke recovery, there's a fascinating story, and it can be years after the stroke. It doesn't have to be right away. ED, so your blood vessels are going bad in your brain and your heart. They're going bad down south too. So that's why erectile dysfunction is actually a really important thing that we talk about. That is your early warning detection, men, that something is going wrong and your heart or your brain are next. So we actually really get on top of this aggressively in our office. And we have, again, the next toy that we have is even going to enhance our ability to do that further. Myasthenia gravis. We have a couple of patients in our practice with MG. Chronic fatigue. People with things that we put all kinds of names on chronic fatigue. At the end of the day, long COVID, vaccine injury, those are all mitochondrial toxins, mold exposure, Lyme, and chronic infections. All of this is the same root. Your body is not strong enough to overcome the insult. And so it goes into what we call cell danger response that we'll look at in a minute. They're even treating some genetic conditions and have some wild stories about things. Okay. So again, this is, let's see, stops and reverses diabetes complications because it reduces the damage from high lipid metabolism. So again, when your body is using free fatty acids instead of glucose for fuel, it makes that downstream exhaust that is extremely inflammatory and restores the missing energy. So the MDI heals the tissues using their own DNA blueprints. So it reactivates the body's ability to heal itself. That's all we want. Let's see what was on this one. The same thing, reducing excessive free fatty acids, causing the tissues to follow their DNA to heal themselves. So over and over, we have the same theme.
I
So
got a bunch of questions, Molly James. Do you want
you
to pause or do you want to wait?
let's wait. Let's get through this because it might
Okay.
answer some of them, and then we'll knock them out. And I'll stay as late as people want to.
Okay. Me too.
Yeah, we'll stay on here. So you can benefit from this if you have any of these conditions or any other conditions, basically. So insulin resistance is the root of all of these things: childhood obesity, dementia, type 3 diabetes, obesity. If you're overweight, if you've ever been more than 20 pounds overweight, you have some type of metabolic process. This will help reverse it at the root cause. Type 2 diabetes, high blood pressure. We talked about that. Arthritis, autoimmune conditions. So the DNA remembers how to generate repair in every cell. We just have to give it the energy that it needs to perform those tasks. And again, they had this is goosebump medicine. It really is. They had a teenager who collapsed playing pro tennis, collapsed, cardiac arrest on the court in the middle of the day, overheated, electrolyte imbalance, whatever it was, in a coma for 6 months at a major pediatric hospital, went on to 6 months of rehab, and somehow the family connected with the doctor I trained with. Sure, we'll start treating him. He came in blind from all the treatments and all of the things. And I don't know if you've ever known anybody who's been in the ICU for 6 months. It's a pretty desperate state of affairs. Like, very few people make it that long alive. So they treated him with the MDI, and he started to get better and said, I want to play tennis. He was blind. And we don't even know if he can see the tennis ball. He is now playing pro tennis. Playing tennis again after a 6-month coma. Like, you don't see that in modern medicine at all. And not only is it goosebumps to hear the story, the kid walked on stage at the conference. It's hard to relay it. It's like just telling you the story. But like when you see a kid that was in a coma for 6 to 12 months walk on stage and say, hey, I'm playing tennis again. That's impressive. So vision loss. So they have type 2 diabetics with macular degeneration and retinopathy that are starting to see again. Anybody who's had a heart attack needs this. Anybody with systolic heart failure, that is a failure of your heart to make enough energy to repair themselves. Kidneys, dialysis, transplant, will keep them going. We've already covered liver disease. They did a study where they looked at diabetics. Now, diabetics, I don't know if you guys know this, they get their legs and feet amputated at a high rate compared to non-diabetics. They did a study where not a single person proceeded to amputation after they started with MDI. Not a single one. They reduced the hospitalization rate in diabetics by 95%. There isn't a treatment on earth that can touch this. Neuropathies, I'm going to present a study coming up that it reverses neuropathy. And I'm going to show you a very exaggerated wound story. But if you have a wound that needs to be healed, guess what? That tissue needs the mitochondria and the energy to go there and heal the wound. So overall impressive. So what we know about diabetes, and this is fairly shocking, and it applied to what I did in the ICU. We know that when we give tight insulin control, so when we really try to shrink that glucose down and control the sugars a lot, all we do is make things worse. We've shown it in the ICU. We've shown it in regular patients. And what happens is even though we make their blood sugar good, they still go on to have the same rate of heart disease, eye problems, neuropathy, kidney problems. We don't change the natural course of that by controlling their blood sugar. The rates are the same. And this is out of the New England Journal of Medicine. This is back from 1993. So again, the data shows MDI improves cellular energy 29%. There's nothing on earth that can do that other than this. At the time they wrote this, again, 15 clinical publications on the actual pump we're using, over 50 on the oscillation or the pulsatile flow of insulin. So I think by now that number is way higher. I'm just going to highlight some of these. Restore brain metabolism, restore cellular metabolism, reverse neuropathy in over 94% of patients, improve nerve conduction velocities, restoring cognitive brain functions of motor, memory, and executive functioning among patients with age-related dementia and cognitive decline. These are claims, if you looked at the researchers who involved in this, these are not sloppy people. These are highly published people who have hundreds and thousands of publications each that are devoted to the scientific process, not the science trademarked Anthony Fauci, like the real scientists who do the real work and have integrity. Restores better blood flow and maximum blood flow rate changes by modulating the free fatty acids associated with dementia. So we're going to improve circulation in the brain. Restored long lost functionality for stroke patients. They treated one patient over 10 years after, and he went from basically chair bound to regained sight in an eye, lost the motor paralysis, and became more active. 30% of lost memory. ALS patients, Parkinson's patients, there's nothing that can touch these guys. We are trying to do it with PRP. We've seen definite benefit in things like glutathione and PRP. There was a Parkinson's patient in their office on no medications with no tremors. And I've heard it reported that we think that Alzheimer's and some of these are amyloid deposits. Guess what? The body can't clean them up. We all have amyloid deposits. It's just their deposits are higher than their rate of cleanup. So if we can increase the rate of cleanup, we can improve the balance on that. Addresses the inflammatory response. So you guys know most people in COVID didn't die of the virus. They died of the inflammatory response to the virus. So being able to modulate that is really important in what we do. So now there's over 600,000 well-documented treatments. They have no adverse effects, no pump failures, no reported injuries to the FDA. It is FDA clear. So devices are clear, drugs are approved. So it's FDA clear. The FDA knows what they're doing with this. It's been published and studied a lot. And again, it's been denied by major governmental agencies because they can't afford it. So, neuropathy in your diabetic patients, they looked at 400 people, and almost a half of them resolved after 12 weeks, another half significant improvement, and 7% no improvement at all. And they went on to improvement after when they extended beyond the 12-week period. Autistic kids. So the neurodegenerative, neurodivergent kiddos, this is a mitochondrial problem in the brain. So what they found is after treating, this is a small study of 20 kiddos. After treating them, their autism severity score dropped at 3 months and was maintained. And it was not dependent on how many treatments they had. So this patient population, as you can imagine, there's certain kiddos not going to want to sit there for 3 hours and get IVs. So if we can at least get them one or two, it's going to put them on trajectory for healing. So this is an important adjunct to some of the things we're doing already, which we're seeing good results in. And this is one of the counterintuitive things. So we want some glucose control, right? We don't want those sugars to rage out of control, but also what we're talking about, there's a difference between what's happening in your bloodstream and what's happening in your cells. And this is one of the hardest things because you may measure a blood level of something that's not related to the intracellular. For example, aluminum. So we might measure the aluminum levels in kids who got vaccinated, but that is not reflective of the tissue and intracellular levels, which are toxic. So that's just one example. So same thing. Our blood sugar levels don't correlate with how much sugar are our cells using. So the next one is a pretty astounding study. So this is Dr. Victor Montori. He's an endocrinologist out of Mayo Clinic. And this was from, do we see a date? I think it was around 2018. This was published 2018, 2019. I'm just going to read the conclusion. So they basically did a meta-analysis looking at glucose control. So our country spends billions and billions of dollars to bring the sugars down, right? We've got metformin, we've got Jardians, we've got Mounjaro, the GLP-1s. We've got all these classes of drugs that are to bring the sugars down. So I love the academic terms of this. Discordance exists between the research evidence and academic and clinical policy statements about the value of tight glycemic control to reduce micro and macrovascular complications. The discordance may distort priorities in the research and practice agendas designed to improve the lives of patients with type 2 diabetes. What he's saying is we spend $2 billion a year and it doesn't work, and we're still doing it because our universities make a ton of money doing it. Mayo Clinic, their own data. It doesn't work. There's the study. This will be available. You can screenshot that right now if you want to go look it up. Here's the citation. It's out there. This was a profound study that they had. So hospitalization and ER rates. So they looked at 1,500 patients, and basically at baseline, they had 46 per 1,000 patients were admitted, and that reduced 95% reduction in hospitalizations after treatment with MDI. So this is a busy slide, but I'll break it down for you. So basically what this is looking at, this is a healthy person, this is a diabetic, and this is a diabetic treated with MDI. So what I want you to look at is the use of sugar and carbohydrates. So in a normal person, when you feed them sugar, look, the carbohydrates go up, they use them, and then they drop back down. In a diabetic, they do not use the sugar. But when you treat them with MDI, it goes even above the baseline of a healthy person. That's basically what that slide is telling you. So this corrects the underlying metabolic process happening in diabetics. Blood pressures should correct over time. The orthostatic hypotension too, we see that a lot when we overtreat our blood pressure. When you stand up, you get dizzy and lightheaded because it takes a minute for the autonomic nervous system to compensate for that. So this graph shows that a little bit. So what about cancer? You might have seen this slide before. So a normal cell breaks into normal cells, a tumor cell breaks into tumor cells. But what if I take the healthy nucleus and put it in dirty cytoplasm, cancer cytoplasm? It makes cancer. If I take a healthy cell and put a nucleus in it, it makes two healthy cells with weird nucleuses. So, what this is telling you is it's not the brain of the cell, the nucleus. They tell us it's DNA breaks, right? You have DNA mutations that are driving this. That's this guy. If this was driving cancer, then these cells down here would look like these cells. What this is telling you is the brain can be healthy, but if the cytoplasm is sick, that's where the mitochondria live. These are little mitochondria right here. If the mitochondria are sick and the cell is sick, it makes cancer cells. So what we want to do is make these sick little guys into these healthy little guys and reverse this process. And the cell danger response, this is a really busy slide. All this is meant to say is if somebody gets sick enough, what happens is the cells just shut down. So think about your house. You've got to bring supplies in, you use them, and you take them out to the garbage. And what happens? If I don't have inflow, I don't have outflow. Or if I don't have outflow, if my house fills up with trash, I can't keep bringing stuff in. So you lose that balance of good stuff coming in, bad stuff going out when the cells are sick. That's what this slide means. Graphic picture. So this is a gentleman who came in. Again, this is not our patient. These are their patients, but I just wanted to show you because this is dramatic. This is bones and tendons. This is one of the worst wounds I've ever seen. I've seen a couple close, but all they did with this patient is they washed it with saline and they had to do this outside because this smelled so bad. So this is a diabetic patient. Normally, your foot is getting amputated. You're probably doing a BK, a below knee amputation for something like this. Okay. So they did MDI every day for 4 months. And here's the next slide. So we're starting to see this is healing up. We're seeing tissue granulated over the top. So I'm going to go back to what it looked like before. Pretty bad, pretty big. This is dead. Is looking better. Looking better. That's the foot at 4 months. This MDI regrew a foot, basically. Like that in my wound, I've run a wound clinic. That is like a 12 to 18-month process right there with good nutrition and good wound care and vitamins and topical support and all those things. This is 4 months. I just wanted to recap. There's a ton more we could say, but I think I've made the point, hopefully, that this is a treatment that nearly every person listening can benefit from. I'm sure you all know someone who's had a stroke, a heart attack, cancer, fatty liver, metabolic syndrome, obesity, high blood pressure, diabetes. Somebody you know, if it's not you, can benefit from this. And it will change the trajectory of their life. It's not just something that they'll feel a little bit better. So why do they slow down or quit? Again, cell danger response, toxins, diabetes. They stop using the right energy supply and the downhill slide. We talked about this is the root of most, if not all, illness and how we can benefit. All right. Make sure you follow us online to get more information. And it looks like we should probably start some questions. All right. So you can tell Sarah and I are both very passionate about this. Our entire team, we've been studying this. I learned about this last May, and we sent one of our patients down to the doctor we trained with in Houston, and she had a couple weeks of treatment in a row. Remarkable outcome. I don't know. Are you on here?
I don't think she's on here.
Okay. She was going to stop in here, so I don't see her on there, but I know she wanted to be here. Okay, let's start at the top. So we have some QAs and we have probably some questions in the chat. Sarah, where do you want to start?
So Ariel and people were talking about the carnivore diet, and we were talking about this process and how nothing can beat this. Things that can mimic this, though, right? So, why do we promote a carnivore or a ketovore diet?
Hmm.
Why is fasting so effective? Because when you hijack this and mimic your own pulsation from your pancreas to your liver by extending a fast into, and I'm talking a fast of 3, 5, 6 days, you will get this same kind of reboot. The problem with that is you can't maintain that for lengthy periods of time. So you can't consistently fast for 5 and 6 days, week on end. But yes, those same kind of principles are benefiting from the ketovore, the carnivore, and really long extended fasting. And there's tons of data to support that too. If you've ever done an extended fast, day 3 is pretty exhilarating. So it's pretty hard on the first day. The second day is a little bit easier depending on who you are. But day 3 for me was something that I don't think I'd ever felt the energy, the brain clarity, the metabolic reset that continued into day 4, day 5. And then I finally broke my fast on day 6. But those kind of things do mimic this, yes. So I hope that kind of correlates with what your discussion was on the side note with the dietary kind of restrictions and benefits of those kind of tools too. The next one is the portal vein is somewhat blocked. I think this is from Kurt. Can this cause repair? And can the repair come after the treatment is done each time? Can that cause the cancer to reside? Yes. What that would be the goal of the therapy, right? Would be to eliminate where your body is stuck digesting these cancer cells on their own. We all have an immune system, right? We all have natural killer cells. Why does anybody get cancer? Why does anybody have these disease processes that we speak of tonight? It's multifactorial. Molly and I don't say that there's one fix for everything, there's one cause for everything. This treatment, however, literally paired with the things that benefit your body the most. So, diet, exercise, clean environment, those kind of things really is profound in a way that it goes directly to a source, directly to the source, to every cell in your body. And as Molly mentioned earlier, each cell in the body has anywhere from 800 to 1,000 mitochondria alone. So when you're treating mitochondria in general, you're treating a vast majority of your cells' efforts, cells' progress. That's what they're meant to do. So when you're actually treating that portion so effectively and so directly, that's when you're going to see this huge impact, this huge benefit of this treatment.
I want to knock out the QA while you're going through the chat side. So I'm going to bounce to this one. So I have type 1 diabetes. Would this basically give me a restart when my body can handle whole foods so I wouldn't have to have as strict of a diet? So the answer to that is yes. So again, he treated his daughter, and I don't know what the frequency is, but she grew up without complications. I think they did 3 a week, which seems high, right? If your dad has one, it's easy. But if you're not, that's burdensome. Maybe even if you did 1 or 2 a month, it would help avoid those complications. So even type 1 diabetics can do this. And if you do it, we probably would shut the insulin pump off during the treatment, but then you would resume it afterwards. So we're actually going to drive everyone's blood sugar between 130 and 200 during the treatment and after. So you're going to carb load before you come in. You're going to sit in our office, and it makes me cringe, but we're going to give you lemonade with dextrose in it. We're going to give you sugar and gummies and things like that. I don't want to overdo it, but we have to have food there available for them. So it definitely would help you with your type 1 diabetes just to stop the downstream side effects. Okay, back to you, Sarah.
Those downstream side effects are not just diabetics. So when we were looking at hypertension, when we were looking at diabetes in itself, neuropathy, erectile dysfunction, excuse me.
Oh, you all right? Okay. I'm going to go on to the next one and we'll come back to you. There's a straightforward one here. Someone who has wet MD, can this help them? I believe it can. So they're actually restoring sight to people with retinitis pigmentosa, which is a genetic loss of the rods and cones in the eyes. So I know it can help retinopathy. I believe they have data on macular wet MD as well. Yes is the answer. And I don't know how many treatments. So there's a lot of people who are asking, like, how many treatments do I need? How much is it? So I just want to address that in case anybody has to go at the top of the hour, but we'll keep answering questions. The answer is I don't know, and it's going to be different for every single person. So the sicker you are, the more we need to do up front to get things reversed to get you to maintenance. Okay. So if you're like, I feel great, I'm super healthy, I feel good all the time, I don't have diabetes, my liver's fine, da 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 da, you might do it once a month. If you're dealing with cancer, I might do 2 or 3 or 4 the first week and then dial back as you're feeling better. So the kind of
Mhm.
gold star answer is going to be about plan 12 treatments to reverse what we're dealing with. And then after that, depending on what's going on, potentially 1 to 2 a month. And if you're doing it for wellness and anti-aging, one a month, one a quarter, whatever fits into your budget and your lifestyle. So they even told us to like look at our skin because it activates the mitochondria in your skin and you will look younger doing it. So I'm not talking about that tonight. That's a different use. We're focusing on the disease side of it, but it definitely can be used on the wellness side too. Back to you, Sarah.
No, sorry, I can talk now, guys. Sorry. So the hypertension, the erectile dysfunction, the limb ischemia, those complications that are the downhill effect from disease process. Even if you were to Google mitochondria dysfunction or mitochondrial disease, the treatment is treat the symptoms. So, whatever symptoms showed up today, let's say your foot was going to fall off, their treatment is to cut your foot off and hopefully get the new wound that they make when they cut your leg off to heal in the poor, already sick environment, which is difficult. Same thing, if you have uncontrolled hypertension and you're asymptomatic and you're like, oh, my blood pressure's always been high. I've always had high blood pressure. Eventually, your eyesight is not as good as it once was. You're suffering from erectile dysfunction. You have neuropathy in your feet or you lose feeling in your feet. What do? They put you on gabapentin. They put you on Cialis. They have a treatment for everything. So I'm going to bounce back to this question on here that said, why are they hiding this? I don't have to be Sherlock Holmes. You're not Sherlock Holmes. They make millions and billions and trillions of dollars because they will write you a prescription for every side effect that you have from that disease, no matter the course of the disease, the cause of the disease. They can write you a prescription for it. They can see you in their office every 3 months. So every 90 days, check that box. You have hypertension, check that box. You have high cholesterol, check that box. They literally make money on sick, not on. So this will never be a treatment that they offer people, I don't think, in mainstream medicine, because guess what? They don't want you better. They don't want you better ultimately.
And I just think we should take a minute and be thankful for the inventors of this, that they didn't sell it to big pharma for a huge profit, because that's usually what happens. When there's a really good technology like this, pharma buys the patent and it disappears forever. So kudos to the man who developed this. And these people are brilliant. And I think the only reason it's not mainstream is because brilliant doesn't always market well. Brilliant people can't always talk to the masses and explain it. Like we've had to watch 3 hour films over and over to really understand and master this data. I went and I learned from them in person. There's a lot to this behind the scenes. I'm trying to give you the stats to pique your interest. And so you know that it's backed by data. We have a 200-page document that lists publications on this. So if you're one of those people who wants all of that, we can certainly get that to you. But again,
So
they made the design of the pump so that once you have the pump, you can use your own product. You're not reliant on them to get the tubing. And that's what I would have done if I developed it. That's their revenue flow. But they made it so that you can take it to Africa and use $10 worth of supplies in Africa and treat people. So the expensive part is the pump. Very expensive. These are good humans, is what I'm saying. They've spent a lot of time to do this right, do it correctly, make sure it's fail proof. I'm just so impressed that we're part of it. And
so yes to the seizures, yes to neurological things. I have a Parkinson's or maybe Parkinson's patient. I'm still not convinced. I don't know, that I cannot wait to try this on. I can't wait to have webinar number 2 where we have before and we have after for you guys. Yes to all cancers. This is probably needs to be top of your list if you're a cancer diagnosis patient, even though we've already started our medical metabolic intervention for most of our cancer patients, which again, even doing MDI is not going to fix everything if the body's not right. We have to do the forework, right? So come to the clinic, get yourself set up for this. Let's do it when we're at our peak to accept the best results from this. But yes to neurological things, seizures, dementia, strokes, We will have that data. It will be coming. We just have to get there.
Yeah. And that's the hard thing about launching something. I usually don't talk about it until we've done it 100 or 1,000 times. And this I'm so excited about. And there's so many of you who can benefit. We want you to know about it right now. And we can build on the experience that they've established for us. And again, I meant to say not that I'm impressed we're doing it. I meant to say I'm impressed by the people who trained us and grateful that we're allowed to do it with them. So I said that wrong in case anyone was recording. Okay. So I would plan if you are in a situation where you have a diagnosis that goes in a chart, high blood pressure, diabetes, fatty liver, metabolic syndrome, obesity, you know the list. If you've got the list, plan 12 and then maintenance. The cost of the treatments are $1,000, which is a drop in the bucket compared to long term, right? We're saving you like 10x to 100x down the road. Plus, you're going to feel better, look better, perform better, all of those things. For our patients, if you are currently our patient and you are on the webinar tonight, and I have all your names, so I got you. I have an introductory special because I want you to do it. I want you to be able to access it. If you're here tonight and you're our patient, you can do up to 4 of them for half price. So if you want to take advantage of that special, email us. You can drop your name in the chat. Katie is here. We can scribble it down, but you can message us through the portal. You can email us hello@jamesclinic.com and say, I'm in for 4. We're going to charge your card $2,000 and get you on the list. And as soon as those pumps arrive, we will get you on the schedule. So I just wanted to cover the bases on that so that we can keep going and answering questions. But I know a lot of people are wondering in their minds, where are we budget wise?
Arachnoiditis, anything that ends in itis. Let's talk about that. Itis, arthritis, conjunctivitis, bronchitis, scleritis, myositis means inflammation, guys. It's cute, right? Itis, they make it scary. It just means inflammation. And that really confusing slide 10 slides ago that Molly said, listen, this is just the visual for you. Inflammation comes from multiple things, right? This targets the inflammation again on a cellular level. If your body can't clear debris, if your mitochondria are clogged, sluggish, toxic, you can't get rid of the itis. I don't care where the itis is. I am flying my mom down next spring to do the same thing for her eyes. She's got terrible macular degeneration. She's already started to get geographical atrophy. It's hereditary. I don't want it. There's things that we can do and learn from this. But yes, anything that has itis, so anything inflammatory, this would be a target therapy for, yes.
So, Melissa, you're definitely top on my list for this because, yes. So, NAFLD, Chelsea, Huntington's, I will ask about that. I haven't seen Huntington's specifically,
I
but
have a
there
Huntington's patient. I'm seeing him tomorrow. So we're gonna have data on that.
we're going to know. I've seen it for other congenital degenerative things. So I will ask specifically if they've treated Huntington's. But again, I would put that on the spot. I know it's totally different disease process, but like ALS, right? The progressive neurologic decline, and it helps with that. So I will be cautious and say I think so, but we'll find out for you. Okay. Tell me
This re-
we answered that, right?
Can this replace GLP-1 injections? Different, different, right? We're working on a different spectrum. So GLP-1 targets a couple other things. So gut microbiome, junctions in the GI tract, transit of the GI tract, gluconeogenesis in the liver, glucagon storage, those kind of things. Can it replace them? It if your metabolism was the problem, yes, if that was part of the problem, but it might be better to say it works good in conjunction with this. So if you've been to our clinic, I look at our clinic and I look at adding MDI. So we already have hyperbaric therapy. We already have platelet-rich plasma therapy. We already do ozone therapy. These guys did a wonderful job. And as Molly said, we should all be very thankful for them passing this knowledge and this information to us to use to serve other people, because that's why we do what we do. Molly, us, the James Clinic, we want to help. But they didn't have the tools that we have. So now I'm thinking do some MDI and get your mitochondria ready, and then stack it with some ozone and stack it with the hyperbaric. Are we going to see better things? I truly think so. I truly think that we have additional resources to amplify this result for you or for your loved one in multiple ways, multiple ways. So I look forward to doing that too. Any type of deficiency, the hypothyroidism, like Molly was saying, is really a lack of nutrition to that organ. Same thing with a heart attack. You lost blood supply, so the tissue is damaged. It repairs the tissue. I don't know if anybody's ever had a head CT. They went to the ER, they had a headache. They throw you through the CT scanner and it says small vessel atrophy or gray matter changes. And the ER doctor goes, it's nothing to worry about. It's aging. It's normal that your brain shrinks in size and it doesn't function well. That's not true. That's not true. Your brain wasn't meant to die before your body. So this is another way to keep the neurons and the neurointegrity of your brain and your body at the same time.
Okay, keep going. We talked about that one. For a cancer patient, how many treatments over what period of time and what determines success? Those are all good questions. So, again, this is what we need to figure out. And I really feel like what we are going to add to this, to build on what Sarah just said, what we're going to add is we have all these other things. I don't think any other clinic that is doing this has all these other things. I know there is somebody who has ozone that's looking at adding this. I don't know where they are in that process, but we have the integrative cancer. We are bringing in the early testing so that I did this, I treated with this, and this is what I got. So you can tell objectively. We've tried to do that with labs and in bodies and things. We're going to build on that in 26. That's what you're going to see coming. So if you've got fatty liver, we're going to quantify it. You're going to do your treatments. We're going to quantify it again so you know exactly where you are with things. Same thing with your heart. How many people go to the cardiologist and get a clean bill of health? And then they go out and have a heart attack a week or a month later. That happens because we're missing the early diagnosis in the current testing. Am I able to get back on keto after treatment? Absolutely. You can continue to do that. It's just really that day that you will need to, you might not want to. You might have enough energy the other way that you might want to have some healthy carbs. I think the problem when we get to diet, the problem is our diet is hijacked with high fructose corn syrup, which is really bad. The fructose side of that is toxic to our liver. So you can't be eating high fructose corn syrup. You need to get out of that. But the healthy carbs, sweet potatoes, corn, like vegetable based, those
Refined starches, yes. Fresh fruits, fresh vegetables. Yeah.
you're going to be able to process those much better. So that's that one. Should we hold off on chemo and radiation and try this first? I will have to answer that in your appointment because that is very specific to you. So a lot of people, depending where you are, I want to see where you are on things because this is going to help any other treatment you're doing work better because you're fighting uphill if you're doing chemotherapy and you're not doing all the other things. I can't answer that as a general statement here, but I will just say, let's talk during an appointment. And if you don't have one, let's get one so we can answer that question specifically for you. When will they be available?
Yeah.
So that is the magic question. So I'm hoping within 2 weeks. So there's a couple of confounding variables. I had it. I was in a car accident. It got ruined. It's taken a month to get a new one. The new one got delayed by the weather. So there's some things out of our hands that we're just praying. We're hoping within 2 weeks we'll have them in St. Louis. We got the first one in Iowa. We're going to be launching this week in Iowa. So we had to delay that from last week. So Iowa's launching Wednesday. And as soon as I get off the call tonight and know how many of you want it, I will be calling to see how quickly we can get pumps delivered. If we were to have a few sessions done, could you eventually do this at home? So they designed this for home treatment, but I do not see that happening. The reason for that is you have to have your blood sugar, your blood pressure monitored every 15 minutes. So I would plan this to be an in-office treatment. All right, Scott and Jerry are in. So Katie, do you have that?
Yay, Jerry. I can't wait.
Oh, we had a winner. All right. Are you still in Sheraton? We got that one.
So this one says, what about thyroid, mast cell syndrome, and mold? So again, backing up just a little bit, we got to get your body in a good place to accept this. And if you're suffering from MCAS or mast cell activation syndrome, mold toxicity, those kind of serious burdensome diseases. We want to get you on the right path before we would do this. But we have those treatments available, right? We have the MAH, we have the EBU, we have the supplements, we have the binders, we have all the things. We are doing this every day for everybody. This is in addition to that, right? This is in addition to our foundation, in addition to us already taking such good care of you, that yes, that would be something to consider once we're ready to accept it. And then Kurt, I don't know who you are. I don't know how I don't know who you are. I'm Sarah Taylor. I'm one of the physician assistants in the St. Louis office. Been here, I don't know, year and a half and loving it. So that's me, Sarah Taylor.
Okay. One other thing I want to interject in here. I think most of you that I'm seeing are already our concierge patients. So if you are interested in doing this and you are not yet our patient, you do need to be a concierge patient first because of all the things Sarah just said. We have to know where you're starting out. We have to know how to manage, like, what are we doing with your insulin pump? What if you're on 80 units of insulin a day? What are we going to do with that? We need to know your before, your during, and your after so we can track progress so that you're going to have questions. How many should I do? How fast? We have to know you to do that. So if you're not already a concierge patient, why not? You need to do that first, but then we can get you on for MDI. We need to do the labs. We need to get you tuned up. So all these things work best. Linda, do you still need to take the NAD treatments or shots? You don't have to. You're probably going to have a lot more energy because we're going to correct that underlying metabolic. Now, you may want to, but you don't have to. Okay.
Can
Keep,
Rebecca and I do these at the same time? If you have a designated driver to take you both home, you sure can. So Molly was saying before the treatment, we really need you to load your body with some good fats and carbohydrates because we're going to deplete your glucose in your system and push it into the cells, right? So directly after this treatment, as Molly said, you need to feed. So you need to go have a good meal. You really need to feed your body to feed those mitochondria to maintain your blood sugar. So I would not want you driving super far or without somebody with you after this treatment, especially the first time. So keep that in mind when you're thinking about scheduling these or how you want to prep for this.
don't pull a Molly James. So
Don't get in a car wreck.
then the car wreck actually didn't have anything to do with this. But leaving the treatment, I was heading down the Houston freeway, bottoming my sugar out. So yes, somebody asked this. Yes, you're going to have snacks. Yes, you might want a juice box or a Coke. I don't like Coke. It's high fructose corn syrup. Get all that crap out of your diet. But yes, you want something. You're going to eat before, you're going to eat during, and you're going to go eat after. So we're going to make sure that you bottom your blood sugar. You're dropping the last 30 minutes. You stay until it's stable. So we're going to get you stable. And then you need to have snacks available to eat. So that, because again, the insulin we gave you is not what's dropping your blood sugar. It's your body waking up and those mitochondria turning on. All right, Linda, we've got you. Katie, do you have Linda down in the Q&A?
I have a neighbor who was I'm saying vax injured, said it was ALS. He is now in a wheelchair on oxygen full time. Could this benefit him? If it was me and that was my loved one or that was my person and this was my Hail Mary pass, 100%, 100% on anything that couldn't get better with modern medicine. For sure, this would be something I would at least put my foot in the door for.
Okay. And I just want to be clear. So the introductory special that we're offering to those of you here tonight is good until end of business Friday. So you need to decide this week if you want to be in for the first 4 at half price, because again, we're trying to get the pumps in. And right now I've got 1, we've probably got 2 more coming. I'd like to have 2 at each location. So if you're coming with your husband or wife or best friend or whoever, 2 of you can do it at once and you're not there for 6 hours total. So that's our goal. The pumps are extremely expensive. So that's our bottleneck right now.
Molly, aortic aneurysm. Is there any chance this would improve an aortic aneurysm? Absolutely.
Yes, because it stabilizes the MMP. And I'm trying to think what I read on that specifically, but yes.
The endothelium, I'm sure.
Yeah.
Yes.
So it's not going to shrink it. It's not going to make it a normal artery again, but it could stabilize and reduce inflammation in the arterial wall. So that wouldn't be my total management strategy, but could it help you so it doesn't get larger and proceed to workup? I will ask specifically if they've seen that, but I would say yes, because we know what it does to and it literally reverses coronary disease.
Mhm.
People who've had before and after angiograms and things like that, and it reverses it. So, yes, Diane, the treatment is done IV.
And there was a question earlier I answered in the chat. Is the sugar given IV? Yeah, it can be. If we have to start an additional line during the treatment because your blood sugar, you're not able to sustain it orally. So if you're drinking, you're eating, and you're still dropping, sometimes, yes, we will have to substitute with some glucose IV. Again, that's why we need to know you. We need to see you. You need to be one of our people so that we can tailor this to you, prevent any of those kind of issues or complications, and get you the best results, the best bang for your buck.
Okay. I don't see cancer mentioned. Also, can it reverse hypothyroidism? So the impact on cancer is profound. And again, we have to get over the sugar thing. They have a pretty remarkable story. I'm not going to share tonight, but it was a pretty profound end stage hospice. Let's just treat because we have no reason not nothing to lose. And that patient is without tumor today, living a vital life when she was bedbound. Can it reverse hypothyroidism? So my guess is this: as long as you have enough nutrients that your body can make thyroid hormone, if we rev up the mitochondria, I do think that is going to help. We'll have a specific answer to that not too long, because we have a lot of you that I think will benefit from that exact thing.
Can I buy the special and use it in April? Absolutely, Carol. Absolutely.
Katie was with me in May when we met. The young man came up on stage. They also had a woman. If you know anyone who has retinitis pigmentosa, it's progressive blindness. There is no treatment for that. It's a genetic problem. They have a woman who's 35 that was going blind and is now driving a car. Pretty profound on that. It again, it's goosebumps. If you listen to the story, you saw that foot. This is goosebumps. And I'm not one of those people. I think most of us are not super impressed by things unless they really move the needle. So to say that is good. Let's see here. Cancer is metabolic. So if you are in Idaho, you are going to have to travel to us for now to get the treatment. There is nobody in that part of the country doing it. As I said, I think there's 6 clinics total. One was in Houston. There now will be 2 in Iowa. And I think there's one in Florida, maybe one in California, one in Puerto Rico.
There's a message from Gary Huff, prostate cancer on our wait list. Can we get his name down to Katie?
Sarah, Joanne has a question for you, and she'd like to do 4.
Joanne Curran? I can't see. Yes. Hi. Yes, I thought of you too, my dear.
Yeah. So there's just a lot of you we know on here that are sending messages in. So Barb writes that I have long COVID in my lungs. Long COVID is a mitochondrial problem across the board. There's people who can't walk, can't type, can't move, can't, their brain fog. Brain fog is a mitochondrial problem. So yes, it should help make them better. Yeah, Melissa, long COVID, vax injury, we've got it.
Cataracts. That's a good question.
Yeah.
I would say that would be something that could be definitely targeted with this therapy, right? These are all part of the cells, abnormal cells. So once you treat the dysfunction, the cells correct themselves and improve. So, yes, I would say that would be a good one to measure too. So, you think of these measurable outcomes, right? A lot of these symptoms sometimes are subjective. I don't feel good. I'm tired. I can't think straight. You can't put a number on that. But a cataract, gosh darn it, you can measure it, right? Your ophthalmologist can take a picture, document it. You can do your MDI, and then you can re-quantify these measurements, these health scores. So that's what excites me about this. These things that we can see, that we can measure, that we can learn from, treat, and then help others.
Okay. So, Joe, we went over the cost. Let me know if we need to do that again. MDI, I think we've talked about where that fits in on insulin resistance. Again, the sooner you do it, the faster it reverses that, the more your body's going to be able to use carbohydrates. So, the cost of treatments we've discussed. So, family history. This is a great question. Would this be beneficial if you don't have these health concerns, but your family history had or has? So, I have a two-pronged approach to that. Number one, we're focused on early diagnosis. So you may not know you have it, but we have some testing that we're bringing in probably Q1, Q2, so that we can give you that early diagnosis, and we will know more effectively than macro diagnosis. So on the heart, MCG is what we're bringing in. It is your micro, your 5 years before you know it on an EKG, on an echocardiogram, on an angiogram. So we're going to get our diagnostics. We're going to bring in some cool stuff to improve that. So that may change your perspective on that. But yes, you can do this for wellness. If you feel great, you have plenty of energy, no problems. You're like, I just want my telomeres longer. This makes your telomeres longer if you know what those are. So if you imagine your chromosomes like shoestrings, the little plastic part on the end is your safety caps. This is the only treatment I know of. There's some that claim they do it that make that longer. When you run out of safety caps, you die. So lengthens telomeres.
So the next one is blood pressure meds, hormone replacement therapy, those kind of things. May they have to be adjusted in the future? Absolutely. That's our goal anyway at our clinic. You come to see me. I love peeling off your meds. I like getting your body to heal itself. This is an additional layer to that. So, yes, we keep an eye on that. We change things usually every appointment. As far as this webinar being uploaded, it's probably going to be sometime tomorrow afternoon or tomorrow evening that you'll be able to share this.
I'm going to try to get it done tonight. So it'll be up tonight or tomorrow because, yes, I need to get it done. So, Melissa, I'm going to go back to how many treatments are possibly required. I would think of it as a 12 pack. If you have a number of diagnoses, and maybe I already answered this when you typed it, think of a 12 pack to reverse disease. So, again, if you're on the wellness side of things, maybe you want to do 3 or 4 a year. But if you're on that disease reversal, we're looking at 12 to reverse, and it may be more. If you're really sick, it may be more. And then we go to maintenance. So, hopefully that
Will
helps.
this will this affect spike protein and vaccine antibodies? It will affect the damage caused by those things, yes. Will it clean them up? Absolutely. In the sense that this allows the cells to do their job, right? That's what the immune system, that's what the body was meant to do. Unfortunately, vaccine and spike protein targeted our immune system, right? The mRNA vaccine. So yes, it can help repair that. It can help reverse that. My wife is enrolled with you and I am not. Do I qualify for this? Absolutely. Sign up for concierge and we will give you the special tomorrow. We'll see you anytime.
Yep. Yep. You do have to be your patient because we have to know what's going on with you. So, yes, you qualify. Just sign up.
Just sign up.
Sign up. Easy. How about congestive heart failure in an 83-year-old? Congestive heart failure has got to be one of the most rewarding because the heart, again, is dependent on the powerhouse of the cells. We're not going to change treatment. We're going to go ahead and start doing it. And then we're going to let the heart recover. And then you can start titrating meds. So we'll let the cardiologist do their thing. I don't have cancer stats. That's one of the things I need to go back and dig into. As you can tell, we've been drinking from a fire hose on the data side of it. And we can have that conversation offline with your specific instance and how that would handle that. At the end of the day, if you've got oxidative stress, if you've got severe inflammation, if your organs are going down, you need it. So, and
So
we see,
back to the cancer, right? We know this. We know that alkalizing the pH of the body is one of the most important tools we can do to fight cancer in itself. There's not a better way that I can think to do this than actually enabling your cell to produce a healthy environment to allow that to happen with the addition of the other things that we already want you to do and that we're telling you to do, we're helping you do. But by giving the cells the tool and the energy it needs to process that oxidative stress, the loss of the tumor cells as the body starts to fight them off, that's where we're looking. Once the cancer starts to die, we have to be able to get that out of the body. And this is one of those pathways that really needs to be accentuated in that disease process. Can it be done through a port? Sure. We'll access your port.
I'm checking on that. I don't know that for a fact because it's all flow dynamics. So I need to check on that. I think you probably can, but I just want to make sure before we verify. I actually called to find out, and they were in a car accident with the bad weather. So I'm calling them
Oh,
after to get some questions answered. Yes. What should we do to get to our peak prior to this procedure? Again, good nutrition. Try to rest. Try to take your supplements that you're supposed to be taking. This is actually going to amplify and accelerate all the other things that you're doing. So there really isn't anything you have to do other than eat carbs, Eat some carbs while you're there. Eat some carbs when you go home.
Somebody asked about a 2-year-old, if
Ah,
that would be risky.
now let me answer that. So we are not going to be treating 2-year-olds right now, but stay tuned. So they are treating autistic children. So there are children being treated. We are bringing our pediatric specialists on board with this. So look for that Q3 of 2026. So it's not a no. And if you need treatment now, give us a call and we can talk through where you can get it before then. Does insurance cover any of this? I think we have to assume insurance is not going to cover anything that's truly going to help you. So insurance is legal money laundering and they take your money and then tell you where you can't spend it. So that'll be a hill I die on. Sorry, mom. Love you. You do good work. Those people don't. Okay. If I signed up, can treatment be postponed until spring? Sure. We absolutely can do that. Again, we just want to get you started. So even if you do half of them before you leave, they're yours to bank. So more importantly, I'm concerned a lot of people want to do it up front, and it takes 3 hours per pump. So right now, I can only treat about 15 people a week, and we're trying to extend that. I am in. Katie has those. Can you use your gift cards? You cannot use your gift cards on the first 4. After that, you can use your gift cards. Got that. Very interested. 12 treatments at 1,000 each. That is correct. And again, in case you missed it, if you are our patient and you want to go ahead and pre-buy, we're going to do 4 up front for 2,000. So you're going to get those first 4 for half price. So that should help you out. Chris, got it. If fatigue is my main complaint, how many treatments? I would start with the 4. And then I would see after 4 how you feel. Because if it's fatigue, I would need to look at your chart and know what we're treating. But absolutely. Sarah, do you want to take the next one? How about Panda's children?
Lost in this chat.
I'm at about 655.
Oh, okay, let me back up just a little bit. I'm so sorry.
You're like me, you're visual, you need to see it.
I know. 6:55. I see Kzada. Where are we?
Kelly Ott, 655.
In the chat or in the
In the chat. So will it help PNs, pandas, kiddos? Absolutely. So
oh
that's
my.
autoimmune condition. That's a brain function
That's a
condition.
neurologic inflammatory condition. So this will absolutely help pandas. Even if they were to get sick again, right? So pandas, kids are super sensitive to sickness. When they get sick, they get that flare of the neuroinflammation, the outbursts, the symptoms, all those things recreate themselves because the brain itself is not well repaired. But doing the mitochondria that crosses that blood-brain barrier, yes, would be huge benefit for these kiddos moving forward.
The arachnoiditis, absolutely, because again, that's nerve inflammation. So I think this can help. Again, it's not going to maybe restore the permanent nerve loss, but it can help. Devin, we got you. I actually think this would be great for you. David and Susan, awesome. Thank you. We will get you at the top of the list. We covered that. We are not charging you tonight unless you said yes, and we probably will still touch base with you before your cards are charged. It will be tomorrow. So, Phyllis, everybody's got people in your family that you know will help. This will help. Audrey, I think this is going to be great to help pain.
Oh, yeah.
Yeah, Kim, I will again check with the all types of cancers, but again, all tumors are mitochondrial at the root. Again, I don't want to oversell or make any guarantees on it, but literally the quote during my training is if your mitochondria are working right, your body can't grow cancer. Okay.
So the
Can
chronic traumatic encephalopathy, yes, I would say that's another thing that this could definitely target on a level that can't be targeted through modern medicine, the brain for sure.
I'll just be blunt. I probably had this 12 hours or 24 hours before I had that minor concussion. So I pre-treated my head injury a little bit. Jeannie, we got you. When will the treatment be available? So I'm going to say We're probably looking about December 15th for St. Louis. Again, I'm going to hop on a call tonight or tomorrow to see exactly how fast we can get the pumps here. Yes. So, Alex, we got you concussions. This is going to be good. But anybody who's had multiple concussions should be doing like our concussion protocol, which is our brain gauge, hyperbarics, fish oil. We've got other things too. CT. Yeah, CT.
So do you have a new pump each treatment? You are connected to a pump. We connect you to the pump each treatment. Yes. New tubing, new syringe, new all that, but the pump is in the clinic reusable.
Yeah. Yep. That's right. So for the chronic, assuming the CTE is the repeated,
Encephalitis.
yeah, you already answered that, didn't you?
I think we got most of these. Some people are saying, how quick do you see improvements? Again, this varies on what we're targeting, severity, long length of symptoms. Are you 10 years post stroke? Are you 2 years post stroke? There's a lot of variables, a lot of things I knew we weren't going to be able to answer. But I would say probably within the first treatment, you're going to notice something.
Yeah. You should notice a little something because again, it's increasing your energy output 30%. So it's increasing your ATP production. That's your energy. We are doing the $2,000 as a pre-sale. Yes, you can basically bank them. So that's fine. We are working, Mark, we're working so that we have two pumps so you can get it at the same time. Yes, absolutely. We got that one. Frank, we got you. Jessica, we got you. Stephen Doris.
Teens with POTS, I would say this is highly recommended, right? These kids are hard to treat because from a functional standpoint, we really got to focus on vagal tone. We really got to focus on fluid expansion. And we know these kids go to school and they don't follow what I tell them. They don't follow what mom tells them. Drink your electrolytes, drink your salt, do this, leg raises and get your calves squeezed all day. So these kids with that little bit of autonomic dysfunction, this would huge impact their life, especially as a teen that has these kind of anxiety, public places because of this dysfunction that they have. They don't live a normal, healthy life half the time. So, yes, that would be a gift for them.
Like a vaccine injured that they said it was ALS. So we have that exact scenario in a patient, and that's exactly who's done 2 weeks of treatment. That is the inspiration of why we did it. We had one patient we knew needed it. So we threw cash and said, we're doing it because she needs it and she can't get there. Yeah, I do think it can help your neighbor. Long story short, if they can just get into our office, that's going to be the biggest issue. And if they can't, you talk to us offline and we'll figure something out. Deanne, we got you. New pump. No, the pumps are reusable. We got that. So those traveling from out of state, how often would you need to be there? I'm getting this question a lot. So what you're going to do is you're probably going to come in. We'll do two in a row. So we'll do whatever day you travel in and the next day, and then you go back home. So you get two in for one overnight stay if you want to do that. So any improvement on cataracts? No. Cataracts is one thing that it will not improve because the lens is there and it's got proteins inside. So there's no way for this to get in there, but it will help with the retinopathy. Glaucoma, I don't know. Glaucoma, I don't know. It's more of the overlying vision. So one of the stories they told us, and again, goosebumps. There was a type 2 diabetic gentleman, and they have these photos, right? They're telling us these stories. They did this for hours. I sat and listened to stories. So I'm just sharing with you what they showed us. The type 2 diabetic man used his granddaughter that was 10 as a cane and walked around. So he went to Puerto Rico and she stayed home and he did the MDI treatment. So the first time he saw her was in their clinic. He saw what she looked like. Cool stuff. Yes, I'll talk to Reed about it. Yes. Please consider how quickly does one see improvement? It depends on what the underlying cause is. So there's no set. If you do 4, you're going to feel like a new person. Everybody's going to respond a little bit differently, But again, the overarching, and I'm always a risk benefit. There's always a downside to everything. The only downside for this is the time and the expense, which you're going to incur those anyway. Okay. So, Kurt, how much time between each treatment? Again, the guy with the foot, they treated every day, 5 days a week for 4 months straight. Excuse me. It just depends on what we're treating and how fast we want to do them. So,
If your foot is falling off, you're going to need a lot of them.
yeah. And we do have somebody that qualifies for that, that we've already have on our list. How young? Again, they were doing this in congenital issues, floppy baby that became unfloppy. Talk to us offline on the little ones. We're not starting with those. We never start with the highest risk. So there's a lot more to the pediatric than the adults. Okay.
Okay. In the Q&A, it says, my daughter lost the tail of her pancreas and spleen diagnosis, NET. Will this help? It's not going to regenerate the organ itself, but if there's organ tissue there, so if there's pancreas still, not just the tail, but the actual pancreas, it can improve the function of the gland that's left. Yes. The spleen, if they took the whole spleen, it's not going to have effect on that. But lacking a spleen, we know affects the process of the blood cells. So yes, this could potentially replace some of that lack of. Did they find it help with copper toxicity? I don't think that was ever mentioned.
I think it does.
Then, okay.
I didn't specifically, but that gets into that toxin, heavy metal, cell danger response. It affects that downstream. So specifically, I can't say yes, but in general, with the detox issues, it's a good starting point because that's one of the underlying problems.
Can this
Okay.
regenerate joint tissue?
Yeah. Would it help lymphedema? It may. I can't guarantee that it will because that's more of an anatomical problem. But again, if we get the body's immune system popping, it'll be better.
So
All right.
regenerating joint tissue. So you saw that it regranulated skin and fat and adipose tissue. Could this regenerate joint tissue? Absolutely. Absolutely. For sure, it would decrease inflammation that's degrading your joint tissue, correct? So by reducing that inflammation and that repeated trauma to that area, already you would see massive amounts of improvement. But then, yes, I think there is the potential for that to regenerate as well.
Okay, I think we are coming to a close. This last one, thinking of sending this to a friend who has kidney issues due to immune. He must have a transplant. I would give it a shot. If it was replacing organ in my body and a lifetime of immunotherapy, I would definitely give this a shot. They've got almost nothing to lose. Yes, it can restore those dormant stem cells. It's going to wake up your body's own repair systems. So joint tissues, again, we're not sitting here saying, hey, this is going to take care of your joint pain. Hey, this is going to fix every problem you have. This is the best jump start that you have to get it going. Okay. Sjogren's, again, autoimmune, it's going to help balance out and regulate that immune system. So I will ask specifically. So when I talk to you in clinic, I will have answers on specific autoimmune, but in general, yes, it's going to help. Last call for questions. Sarah, final thoughts on this technology and how you're going to be talking to patients about it.
I just am excited to be in the forefront of this. When I learned about it, of course, my nature is just to grab onto stuff that's good and share this technology and the potential of it. So unfortunately, like I said, I don't know that we have all the data that you guys want, but I know for myself and for the patients at the James Clinic that we truly love and care about. That is why we brought this in. That's why we were so passionate about it, because it's that next step for us. I tell Molly all the time how much I love working there, and every day is a good day, except I have these tricky patients that I can't get to that next level. I can't get their baseline where I want it. I'm convinced that this is like that last piece of the puzzle. So when I said, come see us, let's get everything established. Let's figure out where you're lacking and what we can do. And then we can integrate this. And I really feel like this is going to break some barriers for those of you who have these chronic conditions that have gotten better, that are already seeing improvement, but just haven't gotten over that last hump. So I'm just excited to see our patients, like I said, the people that we really truly know, love, and care about benefit from this so that we can share it with others. I'm so excited, privileged. Thank you.
Yeah, and to our people, we just want our patients to get better. Like we're so committed to this. We actually had like you guys don't even know. We have people donating money to help us buy these to help patients who can't afford it. So we're truly blessed, and we will try to be very judicious with that and get it in the hands of the people who need it. So yeah, insurance is not gonna help you get healthy. They go off with the pharma people. So um please share this. You all know people who can benefit. Help us get the word out. We're going to launch this. The goal of the inventor is to treat 400 million people. They've treated 600,000. So we want to be part of the lighting the fire to this, getting this to the patients who need it. Again, like Sarah said, we're going to do a follow up once we've got a few patients under our belt. We're going to tell you what we're seeing. Hopefully, we're going to have more specific answers to your questions. How many? How often? When do I start to see benefit so that we can truly tell you what exactly to expect, knowing that it's a little different with everybody. So if you do sign up and you are not urgent to get this and you don't mind waiting till January, please tell us that because again, we're going to be limited with who we can treat and we want to prioritize the sickest patients always and the patients who signed up first next. That's our how we're going to triage this. So um if you tell us you can wait till January, no problem, that might be helpful. Like you're not going to miss out. We're still going to prioritize you, but that helps us. So don't feel like you're missing out if you're like, hey, I can wait till January, no problem. So thank you again for sharing your Monday night with us. Every Monday night, we have a webinar. We are going to bring you the latest, greatest, the best. We're going to answer your questions the best we can. And yeah, we appreciate you always. So take care. God bless and good night.